Okay, welcome to our talk on getting into research by Jack. So yeah, welcome. There we go. Yeah, so welcome to our talk. Make sure to ask a lot of questions in the chat, and then I will collate those and I can answer them at the end. Make sure to send this video to a colleague and share about us, like us on our social media. Just, spread the word. We love your support. And also make sure to fill out the feedback form at the end to get the certificates. So yeah, these are our social media where we have a presence on Instagram, LinkedIn, and Twitter. Make sure to give us a follow to keep up to date with all of our events, our future talks. We have, a lot planned for the future. Yeah. Right. So a little bit about Jack, a friend of mine. So he's a student at Qualitative University. He's basically just done, a lot of research. His CV is just absolutely mental. I won't go into detail, but he's, he's done a lot of really good research at some really prestigious universities. So yeah, without further ado, oh yeah, and this is the feedback form. I will share this at the end for you guys to fill in. So yeah, without further ado, I'll stop sharing and then leave it to Jack.
Okay, let me share this screen. Okay, can you see that?
Yeah, we can see.
Well, let me get on the slideshow. Okay, that's definitely it, yeah?
Yeah.
Great. Okay, so yes, thank you for the lovely formal introduction. But yeah, thank you so much for letting me speak today at Med School Extra. And as you probably know, my name's Jack Wellington. And I'm going to be talking quite briefly about how to get into a bit of research whilst at medical school. Now, some of the objectives I hope to at least go over is how to balance research in medical school, which is a really quite a difficult thing if you don't know how to approach it, how to cope with disappointment and rejection in research, which I'll go into a bit later, but that is a big factor of research, and you have to get to grasp with that. How to get into research and what I did personally, so a bit about me, and how to get the most out of your time at medical school. So a little bit about me. So as Alex has said, I am currently a fourth year medical student at Cardiff University. And I was very, very fortunate after my third year of medicine to externally intercalate. And I went to do a master's in medical microbiology, which is basically infectious diseases, at London School of Hygiene and Tropical Medicine, which I'll get onto a bit in a minute. I have presented quite a few national and international conferences, and most of these projects have revolved around either neurosurgery, a bit of psychiatry, especially neuropsychiatry, which I find quite fascinating, and a bit about neurology. And I've also had the fortune of being published in several journals, some of which higher impact journals include the BJ Psych, World Neurosurgery, and recently a couple of others. Get into research, a bit of a timeline for me. In year one medicine, so I went straight from sixth form into medicine. I was very fortunate to get an offer. And at the right old age of 18, I did not know much about research getting into medicine. I was coping with the multitude of just even comprehending how to approach medical school. So in year one, it was due to personal circumstances, such as health, got in the way a bit. So research did take a step back for me at that time. And I was not as well informed as I was during year one. So year two started then to escalate. I knew that I wanted to externally intercalate. I knew that of all the intercalation programs at Cardiff University, I thought none of these really fitted what I wanted to do. So then I looked into the external intercalation program, and I was very much at this time interested in infectious diseases, especially neuro. So anything to do with CNS infections, encephalitis, meningoencephalitis, and abscesses, or tropical disease, I was very much interested in. So I knew from then that I wanted to pursue a career and pursue an intercalation which focused on my sort of fortes, my special interests. So during that year, apart from exams in Coburn Medical School, I was very fortunate to have landed a fully funded 8-week project at my hospital. And this did involve infectious diseases. I worked a bit on Legionella, and it was very fascinating. And you know, I built a rapport with the researchers, got to, you know, did a lot of bench work, which if you are going to do a more of a sciencey intercalated program, or even a postgraduate degree after you've graduated from medicine and are a doctor, it's good to do some of the fundamental bench work and look from bench to bedside, you know, that translational medicine, which really does underpin research. That is what really fascinated me. So then year 3, this is when I knew that I wanted to do the SFP, or formerly known as the AFP. And this was my main driving goal. I really wanted to at least secure enough publications, presentations to get onto a competitive AFP program. And this was also the time when I externally intercalated. So I applied for external intercalation, I do apologize. And this was, again, quite stressful because I went for a master's program, and the application process is slightly different. It's more formal, and there's a lot of paperwork, and it's a long application process. But then I was very, very fortunate to have landed an offer to study at the London School of Hygiene and Medicine, which it's been one of my dream schools since starting medicine for studying infectious diseases. And then my 4th year, which would have been, which is my intercalation year, I did do the masters. And lo and behold, get on to it later, but COVID-19 struck. This was 2019, 2020. And the intercalated program had to be halted I think it was March. So I then had to convert from in-person teaching all the way into online, which if you're doing a practical degree, which was what I was doing with a lot of lab work, this was very frustrating and had to be taught online, which is not the same as doing it in person. I had to also do my dissertation online, which I was fortunate to have to get a project at Oxford, looking at African trypanosomiasis, also known as African sleeping sickness. But the original plan had to change, and then I had to do a more bioinformatics project, which was a bit of a deviation from the original plan. And then after I completed my master's, which was a 12-month run-through program, so I didn't really have much of a summer, I was doing my dissertation, I then came back to medicine in year 4. But life did not go to plan, as this little image shows. Life does not go accordingly, and you can't plan ahead. And I had to take an interruption because I had surgery. And because in Cardiff we sit our finals in year 4, I thought that it would be best for me to take that interruption to focus on my health, also focus on my family, and really try and get back into the swing of life after my surgery. So hence why now I'm in 4th year again. Let's go to the next one. So a bit about going back to year 1. First 3 years. So as I said, trying to survive medical school in year 1, it was hard to adjust from college and A-levels to full-on cadaveric dissection and SBAs and practical skills, and talking to patients is quite difficult to adjust. And then year 2, I did that summer research internship on Legionella, which is why I've got Legionella pneumophila there as a gram stain. And then year 3 medicine, I really did overdo it, which I forgot to mention earlier. I got involved in so many university societies and taught and lectured, which really does help with your exams. But it was a lot of stress at the time whilst I was also applying. So that was basically my first 3 years. Then intercalation hit. So I was very fortunate to get the place at the London School of Hygiene, Tropical Medicine, but it was a huge change from the medical degree, which they don't prepare you for. I went back to bench work, I went back to fundamental sciences, essay writing, and you know, really difficult exams where you had to go into so much detail. I had to, you know the genetic makeup of many viruses to sit one exam and identify under the microscope different bugs, and it was very interesting but very challenging. As I said, the disadvantages, very intense, 12 months of work, especially with the constraints of COVID-19. It was not easy. Perks, though: gained invaluable research skills, which could translate to my future career progression. And it gives you skills which you wouldn't even necessarily think would help you in medicine, but you know, quantitative, qualitative skills, writing papers, knowing how to come up with a PICO model for research and research questions and reviews. The list is endless. So I really do admire the intercalation program and would definitely suggest it. Key note though, if you are going to intercalate, don't do it just for the sake of a measly couple of points or just for your CV. Do it in something which you are interested in and want to know more of, and can really put your heart and soul into it, because it will be rewarding in the end. And then COVID-19. COVID-19 began. It messed around with everything, and I had to adapt my way of life, learning while still doing a taught master's program. I switched to the online version, had to conduct my master's thesis online, no lab elements. But however, I succeeded and I passed my master's. And the only thing I do regret is not having missing, you know, some of that bench work at the end of my degree and my thesis. So year 4 was quite a hard year for me. I was struggling with personal health issues, and therefore I had to take an IOS, an interruption study, during half of the year to, you know, to recover and solve my ongoing health problems, which were going on for quite a while. And this really, this was a difficult decision that I had to take myself out of medicine to recover and focus on myself, rather than putting medicine first and trying to cope with, you know, with a health condition and also getting through medicine. It was, and finals, it was not easy. So I took time out. And, you know, the big point I'm going to emphasize here is this did not stop my desire to make the best out of a difficult predicament. So during this time, I was quite proactive. I made the best out of my iOS by getting stuck into reading papers on a general basis, getting to know the high impact journals, reading through them. Universities have access, you know, they have open access to these journals. Read the papers you're interested in and have a look what is missing in the current literature. That will help you home in on certain research questions you can then approach to supervisors, and that you'll never know that could be a piece of literature you could get stuck into and get published in or presented. Studying for finals, I took the opportunity, did huge amounts of past medicine to, you know, really confirm my exam results. I conducted and presented research. So the perks of the conferences was most of them were online. So you didn't have to travel, or, you know, you didn't have to concur those expenses. So having it online whilst I was also recovering, I could do it. I could present posters and oral presentations from the comfort of my home and my bedroom, actually. And I also at this time became a founding committee member of the Walter E. Dandy Neurosurgical Society, the UK Medical Student Club, which we founded, a bunch of us founded here to start in the UK, which is taking foot. It's taken off quite gently. And then I also chaired a neurosurgical medical conference, which was a student-led conference, which was in collaboration with Bristol. So, how did I get into research currently? So, progressing through year 4, MBBCH, preparing for finals, and research. This is literally what I'm doing at the moment, and it is stressful, trying to cope with finals and, you know, getting into research and publishing and presenting, especially when COVID-19 is still around and still very, very active. It's difficult to do, but again, it's a motivation. You need to love what you do. You need to get into research which you're interested in. And if you can do that, and then balancing it is not a problem. So what is clinical research? So defined according to the NHS, clinical research is how we develop new treatments and knowledge for better health and care, building the evidence for new approaches that are safe and effective. Examples include, but not limited to, observational studies. So researchers may collect or collate data through medical exams, tests, questionnaires about a group of older adults over time to learn more about the effects of different lifestyles and cognitive health. Again, research questions are endless. And then your more high-profile clinical trials. And as we know, with the COVID vaccination program, these have been going on quite rapidly. So these could be research studies performed on people that are aimed at evaluating medical, surgical, or behavioral intervention. So examples of really quite prominent clinical research. Jameson Scurvy trial in 1747, it dates back, honestly. Some of these trials can go back to the old ages. And obviously scurvy was a massive problem on ships, and James Lind knew that vitamin C was then if you have a deficient vitamin C, therefore causes scurvy. So we trialed this in 1747. Birth control pill trials in 1950s, the simvastatin survival study group, the Child-Pugh score, and then finasteride. All these are just examples of some of the groundbreaking research which potentially you could get stuck in as early as a medical student. And why is all of this relevant? Why is it important? Today's research is tomorrow's care. Again, it's that bench to bedside, that translational medicine. Through clinical research, we may deem treatment options as safe and effective, demonstrate whether treatments have any adverse drug reactions, side effects, show whether new treatments are better than current standard treatments, you know, your auditing and your trials, quality improvement projects, address issues in current standard medical guidelines via auditing and quality improvement projects. Clinical research can also help to prevent illnesses by testing a vaccine, quite relevant nowadays. Detect or diagnose illnesses by testing a scan or blood test. Treat illnesses by testing a new medicine or device. Find out how best to help people with their illness and help people control their illness or improve their quality of life. So why should you get involved? The bread and butter of this talk. Getting involved in research early is both beneficial for your clinical and academic career progression. Remember, when you're applying for medicine, to be a doctor, there is a triad. You need to be a scholar, you need to be a clinician, and also you need to be a scientist. Getting stuck in research will better your career as a clinician, a surgeon, a psychiatrist, a GP. It's getting stuck in there and doing it early. I emphasize research because this is very important if you're considering an academic career. So the AFP or the SFP and clinical fellowships, which later on in your career. These are immersive academic programs whilst you work, and having early research projects and publications and presentations will help you get those positions, and they are competitive. You can boost your CV by presenting at conferences or getting published. You know, you can also apply for postgraduate qualifications. You could get a PG cert in medical education when you become when you do your foundation training. These all count as, you know, extracurricular, getting research and getting projects through these degrees. You can also get ahead of the competition for national job allocations, especially when it's competitive specialties and consultancy positions. So those run-through programs such as neurosurgery and obs and gynae and ophthalmic surgery, these are very competitive, and surgical specialties also, and certain internal meds specialties, the positions are getting more scarce, and therefore the competition is higher. So you need to have your extra things on that CV to basically bump it up. You also gain invaluable skills and experiences you wouldn't get at medical school. You know, even just doing a bit of bench work, a bit of petting, you get skills which you wouldn't necessarily get from just sitting in a lecture or being on placement. You can also have the chance to influence tomorrow's doctors and healthcare professionals, that role as a scholar, and influence the future of medicine, which I find especially very exciting. So how to get involved? Probably what everyone wants to know. It is easier said than done. I'm not gonna lie, it is quite difficult to get some of these projects, and there's a lot of emailing and a lot of trying to befriend supervisors. It's not as easy as people say it is, but it is possible with a bit of oomph and a bit of motivation. You can definitely get there. How I started: join university and national society research committees, student-led committees, national societies, and the RSM, etc. Your local university societies. You can definitely get involved in, you know, research this way. It gets your name out there, it gets more things from your CV, but at the same time you get to know people. And research, an easy way to get in is to know people in the field and befriend them and get in that way. And again, if you need to put yourself out there to get rewarded. Approach seniors and peers experienced in publishing research. Don't be shy. You have to have this cheekiness to you. This, you know, you have to be selfless and also selfish. You need to, if your peer is experienced in publishing research, ask them how they got into it. Ask them if there's anything they can get involved in. If, you know, a senior is happy for them to supervise them. It's all about asking. And if you don't ask, you don't get. Consider intercalation or a postgraduate qualification. My intercalation allowed me to get contacts at both LSHTM and Oxford. And you also meet a bunch of great people on these degrees, notable characters, and they really do help put a word in when you are trying to get into research. Apply for summer studentships and internships. These are quite competitive, especially the funded ones like the Wellcome Trust. Vacation studentships, they can be quite, or Inspire, they can be competitive, but very useful if you get onto them, and some of them are paid, so would help towards, you know, funding the summer. Contacts are key. You should, if you get into research, you should have a good contact list. It's invaluable. Know people you can approach, especially when you want to choose your electives or your SSCs, your student selected components or projects. This will help a lot easier than just, you know, batch emailing a lot of people, which can get quite frustrating. And another thing to emphasize, we need people. Research is always wanting more people to help out with projects, even if it's a review, a systematic review. And a senior wants, you know, wants another person to help edit the final draft, or, you know, format it for a journal, and you can have your name on it. It all counts. So get stuck in there, because a lot of projects and seniors, they will want additional help. So examples of what you could do: original articles. They are very, you know, this is your top end publications, really difficult to get involved in. You know, it's a challenge to get onto some of these original articles, you know, these trials, these also these some high-end audits, and they're not easy. But if you ask around and get onto and get involved in national student committees or research committees, then sometimes they'll run national audits, and these can also help you. You know, you can also get involved in these and data collect and be hospital leads, and even get onto a steering committee to help write the paper. That is probably the best way to get onto these articles and these projects. Systematic reviews, they're very useful and evidential, but they can be a nightmare to do. and you need a prior knowledge of how to conduct them, hence why I put the Prisma flow diagram there. Systematic reviews can be quite long, arduous, and you do need to put time and effort into reading through scouring through databases and whittling it down to, legible papers to include in your study. Case reports. Now, case reports are elusive, but they are a great addition to your CV. If you, the best way to do this is by when you're on placement, or you have a supervisor who, say, is a consultant surgeon or internal medic. Ask them on placement, is there anything interesting? Is there anything which you could write up? And a lot of consultants and academic doctors who regularly do case reports, they'll have reports which need writing up, and you can get involved this way and say, can I help write? Can I help edit? Can I help get involved in these case reports? And that's then you can present to a conference, or even get published in, say, BMJ case reports. Obviously, patient written consent is needed for case reports, and this is another part of case reports, is you need to get consent to write up and present, etc. But they are elusive, but great additions to the CV. Literature reviews, a simple narrative review, they're quite difficult to publish. It is possible, but usually people who write these critical reviews, these editorials, they're experts in the field. So these can be quite difficult to publish and present, but definitely try, because 9 times out of because 1 out of 10 you might actually get accepted into something. And letters to the editor. I say probably easiest to publish, but most of these things do take time and effort. It needs to be, a letter to the editor needs to be topical, and sometimes it has to be a rapid response. So, within an article within 4 weeks of being published or accepted on a journal, then to have a response. These letters, you need to be frequently reading journals to identify whether there is something you can write a response to, whether there is, a critique of a paper which you can write a letter to the editor. They're only short, but they can be quite specific. Therefore, when you want to publish one, if you don't get accepted into a journal, then you might have to, write another one too, because it has to be specific to something. Or it can be general, but most of the time it's usually a topical rapid response. So why is this all important? Presentation. So this is a screenshot of the core surgical training selection criteria. And as you can see, you get different scores and different points to what type of presentation you've done. So the highest would be an oral presentation at a national international conference, and it has to be a recognized body such as the Royal Society of Medicine or Royal College. And then it goes down certain, on what you've got, like a poster or etc. And you get points allocated. And obviously, the more points, the more chance you're going to get selected. And then your publications. So as you can see, first author, joint first author, or you've of 2 or more PubMed cited original research publications, or in press you get full marks. And this can be difficult. First author, is the person who puts the most work and effort into that publication, and that can be quite difficult if, especially as a student. But honestly, get stuck in there and ask. And again, you have to be selfless to be selfish, and selfish to be selfless. Ask if you can have and clarify what authorship position you will get if you do this XYZ amount of work, and then a supervisor should be clear on that. So, personal tips, which I did find helpful. Make a LinkedIn account if you have not already. A lot of my contacts and a lot of people I've done projects with is through LinkedIn. It's a professional social media, and you can really promote yourself in an academic professional way. And it's also good for job interviews and lots of other job notifications and opportunities, etc. Do not overdo it. Do not fall into the category where you are doing more research than actual focusing on your medical studies, because it has to be a perfect balance, which is difficult because one may, alter the scale slightly. And if you do more research in medical studies, then your medical studies can go down, and you need to have a focus on both equally. And as I said, have a balance in clinical, academia, and studies. Do not prioritize research over your fundamental clinical competencies, because you will regret it. Those precious sign-offs at the end, you need to be clinically competent, because remember, at the end of the day, you are going to be a doctor. Research is an aspect, but at the end of the day, you are going to be a clinician. So do not prioritize research over your fundamental clinical competencies and duties. And conduct research on what you are passionate about. Don't get dragged into a project where you are not that passionate about, you don't really want to do, but you just want your name on it, or you want to be recognized on it or present something. Because at the end of the day, that research is going to be a representation of what you put into it as well. And you don't want to conduct research half-heartedly, and it's poor and not up to the standard it should be, because then that will reflect on you. So conduct research on what you are passionate about, and highlight certain contacts you can get involved, you can talk to an email, which, and specify what you are interested in, what you want to do. Is there any gap in the literature you want to pursue, whether it's a good idea or not? And do not do research just for the PubMed IDs. Now, the foundation program allocation and rankings, they're not including PubMed IDs soon, but before it was, you get 2 extra points if you got 2 PubMed IDs. Do not just do it just for those PubMed IDs, even though it's tempting. Remember, research is to help the patient in the end. It's to benefit patient care and quality of care. It's not just for your own benefit to get XYZ amount of PubMed IDs, because at the end of the day, in the grand scheme of things, it doesn't really matter. It's about conducting research which you are passionate about, and you want to get your name on because you want to put your name on something which will impact and will highlight gaps in the literature. That's more exciting than just seeing your name on PubMed. That's my personal opinion. But just do not do it just for those PubMed IDs, because it's not worth it in the end. Okay, some do's and don'ts in email etiquette. Emailing is probably going to be most of how you're going to get contacts. So some of my do's and don'ts. Definitely make sure to be respectful and formal. Don't just send a cheeky email saying, I want to do this, do you want to do that? It's 9 times out of 10, they're not going to read it. So outline who you are, what you want to get involved in, and why. So, I'm Jack, I'm a 4th-year medical student. I want to get involved in neurosurgery, academic surgical, surgical academia, and I'm interested in neuroinfectious diseases, cerebral abscess, etc. And why you want to do it. Don't just say, I want to do it for extra points on my CV, blah, blah, blah. Say, I'm passionate about this because I saw this in a journal, I saw this in a presentation, I saw this at a conference and want to get involved, and etc. That will be more, you'll get more of a reaction, and then probably a reply if you go down that route. Make sure to attach an up-to-date CV. I always attach a CV to any email if I'm going for contacting a supervisor or a potential supervisor or projects. Even for an SDC, I'll put my CV on, and they can have a quick read and see, okay, this person's serious what they want to do. Make the email individualized. This is a problem when you batch email and send the same email to so many different supervisors. That does not work. And people know people. So if you've sent, 2 neurosurgeons in the same department, the exact same email, they'll just probably ignore it. So make the email individualized, and why you want to be with that, to work with that potential supervisor. Read a bit about their bio, just Google and just see what they've done and read some of their literature and etc. That will be more impressive than just cold emailing. Do not over email. Don't keep every day keep bombarding someone with an email. Have you read this? Just don't do it, because they won't reply. Do not send emails to loads of potential supervisors in batches. It doesn't look very good. And, you know, you have to have some background of the research in question. So make sure, you know, make sure you have actually read the publication you're stating, or, you know, that person's done. Because if you went to meet up for coffee or had a formal interview and you've said, you know, I've read your publication XYZ, and they said, oh, tell me a bit about it, and you don't know, that will look awful. So definitely read up on the person and their publications and work. Do's and don'ts in CVs. So some of my do's: outline relevant details. Do not waffle in an academic CV. Waffling is probably the worst thing you can do. It just wastes pages and it's just irrelevant. So just outline the relevant details. So for me, I always, you know, presentations, both poster and oral, and state whether they're national, international, regional, etc. Prizes, even if you're shortlisted for a prize, just mention it, because it will look better than not mentioning it. And publications, cite your publications on your CV. Make sure to make a list. Make sure to list your past, present, and future research endeavors. Just a little bit. Just say what you've done, what you wanted, what you're doing now, and a bit about what you'd like to pursue in the future. It shows that you're proactive in your research acumen. Do not waffle. Do not make it too long. We don't want a CV which is 32 pages long. Do not lie. Just don't, because you'll be caught out in the end. Liars, you know, it's clear that you fabricated it, so just do not lie. Rejection. So a part of research is that you are going to get rejected at some point. All individuals pursuing clinical and surgical academia should grasp that rejection is a normal component of the process. Personally, I've been rejected from many conferences, committee positions, prizes, and journals. You know, especially with journals, even if the article seems like it should be published in that journal, the editor's like, no, I don't really want it there. You know, that just happens. I've been rejected before peer review many a times. But do not give up. Be resilient. Do not let one journal's position influence publishing bias. Just because, say, you've got negative results from a project you've been spending 8 weeks on, or even a year on, don't just, you know, go, oh, I don't want to publish it in this journal because I've got negative results, therefore it's not, you know, they're gonna reject it straight off. That's called publishing bias. Don't just do it for that reason. You know, journals will accept negative results. It's a part of literature. It's to say that we've tried this, it didn't work. You know, or we didn't find something which we thought we were going to in our hypotheses. Publishing bias can be a problem, but do not let this influence your journal's position. Take the comments on board and revise. If the journals come back to you and said, oh, you've got minor revisions or major revisions, make sure to read over them and see if you agree, and if you agree, you know, change it. But again, it does take time, it does take effort, but keep going at it. And then personal development is key. With research, you really need to be resilient in the fact that a lot of it might not work at most of the time. And it's just that one thing which will benefit you, that one finding which may escalate your career or benefit mankind in a certain way, in patient care. That is the most rewarding thing, and beats all of the rejection during the path. So, who to contact, personal tips. The internet and social media are powerful assets. I mean, most of my opportunities is being through LinkedIn and even Facebook, and knowing, you know, contacting consultants, and, you know, don't be afraid. It can be quite intimidating just to go to a consultant and be like, I want to do this project. I want to pursue something with you. Because if you don't ask, you don't get. And even if they don't reply to you, take that as, okay, they're not interested, move on. Don't linger, because you're wasting time. So, as I said, internet and social media, powerful assets. And if you haven't got LinkedIn, make an account. If you're waiting too long for a response, move on. Time is precious, and you want you want to impact the world quickly, move on and email someone else, or contact someone else, or do something in time. Doctors and high-profile academics are very busy, so bear that in mind. If you do not get response in a day or two, you can, it's more the weeks and weeks, the endless weeks that nobody's replied to, then you can move on. But remember, high-profile academics and doctors are very busy, especially with COVID. And so don't be afraid to send a little reminder email in a week or two, just to say, because they might not have read it. Be innovative. So when I say be innovative, it can mean two things. It means obviously being proactive, but at the same time, if you have identified a gap in the literature, which you know is a gap, and you know that you can, say, do a systematic review or something, then go for it. You're not restricted. If you have enough evidence to suggest, or you've gone through a PICO model and identified this research question, and you want to pursue this, and you're having trouble finding a supervisor, start pursuing it. Start getting through the motions of starting that project, and get people involved. Ask your peers, are you interested in doing this review with me? And they'll say yes or no, and then start. Be innovative. If you don't take that first step, then you're not really walking, are you? So it's, again, using your hindsight and knowing if there is a gap in the literature, and you're passionate about pursuing something, then do it. Get in touch with some of the national student research bodies. So NSAMR, Star Search, they do audits quite often, international audits and national audits quite a few times. RSM, the Royal Society of Medicine, they have so many essay prizes and student prizes, it is untrue. So, have a look and see what tickles your fancy. And then obviously I'm the VP of WEDMS UK. If you're interested in neurosurgery, neurology, psychiatry, or anything in between, get in contact, and we can, we are starting innovative research-led programs, and become a member, and we can hopefully guide you as well, and have things in common with your peers. Say, if a bunch of you are interested in psychiatry, then make a little group so you can help each other out. One thing I will say about getting into academia and getting onto these competitive positions, people sometimes can take competition quite fiercely, and don't be scared of that. You need to definitely keep that in mind. But at the same time, if someone's struggling, or someone needs a hand, then help. We're all human beings at the end of the day, and people need help from each other. So definitely help your peers, make a little group, and bounce ideas off and see what you can do, and then that you can publish together, present together. The opportunities are endless, really. So hopefully you've enjoyed my talk, and I'm very grateful for you guys letting me speak today. And as I said, any further questions, email me or message me on Facebook, LinkedIn, and I'll try and answer your email message as quick as I can. I'm sorry about the PowerPoint issue. I didn't know one of the animations was there's a problem with it. So thank you very much for letting me speak today, and I will take any questions if there are any. So thank you very much.
Thanks, Jack. Yeah, that was a very informative talk. I certainly found anyway. So we have a couple of questions.
Sure.
So
I'll try to answer them as best as I can.
Yeah. Some of them I kind of bunched together. So first one is when should you start doing research and CV building? Is year 3 a good time? Okay,
so from my personal opinion, year one was basically I didn't do much at all apart from the SSCs and what's part of the course. Year 2, I started getting stuck in. So I would say it's really an individual thing. Obviously, leaving it to the last minute, is not ideal, but at the same time, do it when you feel comfortable and have got a stable, work-life balance. You know, you don't want medicine and research being the only thing you do. You need to have, because you will, you know, you will lose the will to live. So you need to definitely have a good balance. And I personally, I started in year 2.
Okay. What are the most difficult aspects of doing research?
Oof. It depends on the individual. Again, most of these are individual things. For me, it was obviously I don't have. I'm going to be the first doctor in my family, first degree in my family. So for me, I didn't have any contacts or anything like that right from the beginning. I was very new to it, and sometimes medical school might not guide you on some of these extra things. So you have to be quite proactive. So I did a bit of, self-directed learning. I looked at how to even conduct research first, looked how to do a review, looked what the format of a case report is, letters to the editor, and then looked at the different types of articles out there. And then I read some journals, updated with the Lancet, BMJ, etc. And then found what I was interested in, knew that I wanted to intercalate, knew that I wanted to do an AFP, SFP. And then my first proper bench work was my funded summer project. So most difficult aspect for me, and it still is today, is statistics. Statistics in research is quite difficult, and I'm not the greatest. I'm not gonna lie, but that's the hardest. It's adapting. It's a different type of way of writing, scientific writing, getting used to it, and just starting, I think, is the hardest thing. But once you've started, it will flow.
Great, it's great you mentioned statistics, because I have one question that's about that as well. So I want to do research, but I don't know enough stats or analysis to do it. Should I focus on qualitative instead of quantitative research?
Okay, so there are a lot of resources online which talk you through basic medical statistics. So I know Star Search, there are some, I think it's the Incept Learning, there is modules on how to get in, like how to start with statistics. University courses, most medical degrees now have at least a package of statistics. So if you're really struggling, ask the medical statistician responsible for part of that course, which can help you and get you into evidence-based medicine also. When I did my intercalation, I had to do a statistics module. That helped a lot. So there's always that part of it. And if you really are struggling, ask someone who, befriend someone who knows their stats. It's like a medical statistician. Most research teams have someone designated to go through the stats. So it's a good way to learn from them as well. But I would start with the internet, look at basic stats, odds ratios, probability and predictive values, work out those basic things, and then do some of those modules I mentioned on Star Search. They're quite good.
Okay. How do you find a good supervisor, and what should I take into consideration when finding someone?
Again, it's an individual thing. So it's the big thing which I find when I'm looking for potential supervisors is rapport, is if you can get on with them. So an email, you can't judge someone over an email or a text. You need to, formally meet, grab a coffee, or over Zoom because of COVID, and just talk to them, get to know the rapport, and then see how you feel afterwards. If it's in your gut saying not really fond, then it's the dynamic is probably not going to be great. Find someone you can gel with and who is pleasant and really enthusiastic about teaching students. That's another thing. Then it will go smoother than someone who's a lot more cold and distant. So I think it's judging character and building that rapport.
Okay, last question. Well, a couple of questions.
That's fine.
All based on sort of the type of research. So what types of research should I do as a beginner? Do some research look better on the CV than others? And are some research easier to publish than others?
Okay, so this is a common question. Um, for me, it really does depend on what type of research you want to start with. So if you're new to research and you don't know what you're doing, again, supervisor is going to be your best friend or someone who knows how to get into research. There is no, when it comes to articles, don't publish just because one's easier than the other and one may take less time than the other. I find the more extensive projects, which go on for a while, are probably the most rewarding. So don't just judge it on what's easier to publish. But to start off, I would definitely get a grasp of how to do a systematic review. Because if you go into Intercalate, for example, your thesis might be a systematic review. So learn how to do a review and also get to grips with critical appraisal of literature, reading through papers. That's probably I would start with that first, then before grasping, different protocols such as Prisma. But I would definitely start with basic lit review. A search using the databases as well, knowing how to use your Boolean operators, and looking and doing and making a search stream. Those sort of things are invaluable. So learning how to do that first and critical appraisal and understanding papers and their terminology is better than just being stuck into an original article you don't have a clue on what's going on. So I would start with that.
Mm-hmm. Okay, so right, that's great, Jack. So thank you for that talk. So I'm just going to share my screen again with the feedback form. So yeah, if you guys could fill that in, we'd really appreciate that. I'm sure Jack will be willing. Well, Jack will be eager to see how people found this talk. Yeah, just please fill it out for the e-certificates. Okay, great.